As far as me, in the hospital, they were not kidding about the recovery. The surgery itself, I didn't feel any pain from the surgery itself. What I did feel pain from was it, and my doctor's not really taking it seriously, is from the drains they put inside of you. They put these drains, if you look up JP drains, you'll see they put these drains inside of you because supposedly many people, there's blood and water accumulation, which has a tendency to turn into an infection. And so, of course, the bigger you are, they're always more concerned that you're the one who's going to have the problems. And first it was if they felt it was necessary to, they felt they were going to do it no matter what because of my size. So they put a med vac on me, and it sounds almost like bubbles. It didn't really bother me. It wasn't, it was like kind of like white noise. So they had me on that. So basically, what they do is they leave when the incision is from all the way around from one side of my waist all the way around to the other side, but they leave about that much open to drain because again, infection. So there's a med vac, and what the med vac does is suctions out all the fluids out of you so that you'll heal faster. I was fine. I just felt discomfort from the tubes. It was a little hard for me to move around. I wasn't allowed to take a shower. I had to do a bird bath, like my therapist said. It was really cold when I went in to have the surgery. Everything turned out fine. But he only does surgeries, I think, Wednesdays and Thursdays, and I chose Thursday because Wednesday was school for my son, and so you stay there, you go home the next day if you just have drains, but if they do a med vac, you go home the following day. So I was supposed to go home Saturday. However, they said I cannot take their med vac, and they had to go through my insurance company to get me a med vac to take home. And so they're trying to tell me that it's Friday, it might take a few days, so I can't go home until they can secure me a med vac. And I was like, nope, I am going home. The bed, and they said that this is a problem. All the patients complain. The bed itself wasn't that bad, but for some reason, the butt part, I'm still in pain in my coccyx. It is so painful. The actual surgery itself, I didn't really feel pain. It was just my back was aching, my coccyx was aching, I was feeling itchy. They said I would feel itchy, so they prescribed me Benadryl. I brought my own pills from home, and they said they prefer that I don't do that because they need to know exactly what I'm taking and they need to have it on record. So, the hospital. The only complaint I had was how bruised I was when I came out of the OR and the beds, and they also seem to like cut back a lot. Like the internet, as soon as you put your phone down, you're off the internet. You know how your phone automatically turns off? Well, phone automatically turns off, and they kick you off the internet, and you don't know it, and you're using up your data. And so I felt they kind of like, from what I could see, they were very held back a lot. I don't want to say they were being cheap with food. They forget it, but it just felt like they were like really holding back on what you get from there. But like they gave me a little bit of hard times about the meds. If I don't need meds, I won't take them. But my butt was in so much pain, and my back was in pain. And they were like, "But how's your surgery?" I said, "The surgery itself isn't really bothering me. It's this bed." And so they were kind of almost trying to make an excuse not to give me meds, but they come around asking you how the nurses treated you, so they would give in for the most part, and they, gave me tramadol doesn't do anything. They gave me the Dilaudid, which is what really helps, but what helps me is the whole one, I think 1 gram, I think, or 1 ounce, and they would cut that in half, and that doesn't really do much for me. Just like took the edge off, but I would say for the most part, I mean, I really didn't have much complaint except for just those little things I noticed, and just the bed that was my chief complaint. Was the bed itself was hurting my butt, the cocks. I am still in pain in those areas that I can't. I mean, places that I was comfortable in, like my own chairs, or my the therapist chair, because I see a therapist because of my anxieties, and never bothered me, and now I can't, even if I'm sitting too long in the car, I'm in severe pain. And because I do a lot of driving, I'll drive my son to school, then I might have to go to an appointment and then come back and get him. I might stop and run some errands, and you know then so being in the car that long was really difficult. um it's exhausting now more than ever, and I've had, again, appointments every single day. I was home for the 2 weeks for the most part, but I did have to go to my follow-up appointments, and my husband took a week and a half off and he drove me around, but then came that Monday, can't remember, like the second week of November, I guess. I had to be, he couldn't take any more time off. So back to the daily grind for me, and it's been kind of exhausting. Like I said, I think only one time I actually was able to just wait and relax at Dunkin' Donuts. But for the most part, I was driving either to go to a doctor's appointment for my daughter or for me, or maybe I went to like the Dollar Tree to get some more of the dollar makeup from Beauty Benefits, or another time I went searching for the brushes for the half price sale, and they were like sold out everywhere. And then one place, I didn't go out of my way, I just went to the ones on my way home, and then one place had one left and they gave it to me. So stuff like that. And today I was supposed to get tomorrow off, but the dentist asked us to come back tomorrow, and really mostly for my husband. He did a deep cleaning, and I only needed my bottom teeth deep clean, but he needed both sides. So, and plus I got to get my son's meds, so I have to go out tomorrow. I thought I was going to have it off, and I was going to continue the Zodiac series, but quite honestly, I had to get the med back ready to return it. I can't keep it. I did a little bit of online Christmas shopping for my nieces and nephews. I have to change clothes much more often, and pajamas and stuff, because since it's open, and I basically I couldn't use the med bag. It's constantly draining all over me, so I go out and my dress will be soaked. It's not blood, it's like a yellowish pinkish color that comes out. And so I had to put away clothes. I have to wash clothes more often. My kids will help me washing clothes, but I like to put it away myself. So I had to do my pills. I had not done my pills in a week. I only take what's absolutely necessary, like my high blood pressure pills, and my my stomach pills for the acid, and then of course my anxiety pills, and allergy, because my nose, forget it. And so basically the rest of it, which is, vitamin A through E, and, the biotin, and my liver pills and my kidney pills. I just take one of my kidney pills. That was like, all of that was on hold. I would just take one of the kidney pills, the Chancapiedra, which really breaks down the stones. So, I had to get that done. And so yeah, So this is like my first day off. So I did those things, and I really, really did want to do a video to show you that. And I said, you know what, I really can't. I'm really not up to doing a tutorial, but I really would like to try this out. So basically, I just put on a little bit of foundation. I just did. I didn't even like put anything on the whatever I had left over on my from my pomade on my brush. I put on whatever I had left over on my blush brush. Um, I just took powder. Just did this on my eyes because it spilled everywhere. I figured let me use it, and then I said, you know what, I really want to do the lips. I've been wanting to do this for like a year. So that's what I did, and so yeah, so they were trying to keep me in the hospital, but they said that they're pushing. Not if you remember once I was in the hospital, and they were like, whatever, we get the records when we get the records. Meanwhile, I'm there for 5 days. That wasn't happening, especially with the pain I was in from that bed. And so they kept telling me, the assistant doctor, the nurses, and whatever workers are there. I think there were social workers, or because they help get what you need, like the med vac. I'm not staying. And they're like, well, we'll do the best we can in getting it. No, they're not hearing me. I'm not staying. When my doctor came to see me, my actual plastic surgeon, I told him, I'm not staying. And so he's like, no problem, I'll sign you out, and we'll just, if you can't get a med vac, we'll just have to dress the wound. But like at 6:30, some guy came with a ginormous box, and that was my med vac, and it had tons of supplies and tape. But the tape that they used on me was itching, and I never had a reaction. Must have been allergic to it or something, and I was scratching so bad that when they gave me my med vac to take home, which is really just a rental, it started beeping. And they were like, instead of dealing with it, because I think there was like a lot of people and only one nurse, and I mean, for the most part, those nurses were great. She didn't have time to really deal with it, and she's like, well, it's just sensitive, it'll be okay. But I mean, it was okay. It sounded like bubbles were inside of it, and you put it on like a pocketbook. You have like a bag you put it in, and so you're walking around with these tubes coming out of you, and this bag that's bubbling. And I know I stopped in one or two stores on the way home with this thing. Get home, I'm just trying to relax. I ate, and they feed you really good in the hospital. And of course, I tried to eat healthy. I try to stay away from carbs, but I did eat some carbs in the hospital, and since then I've been eating carbs again. They showed me a picture, and I keep asking them if they could send me the picture through my text, but I don't even know if they still have it anymore. But they showed the panis, and I've seen it online. It was humongous. They put it on the scale, and you could see the middle was black. Then you have it's like two bumps on the side. It was the weirdest thing. So he told me I wouldn't have a belly button, that he would just chop everything off. But for some reason, he went a little bit more below the belly button than I would have expected, because, again, that was all infected skin. But at least it's not hanging over. I mean, I have a lap now. I have an actual lap now. But it still kind of hangs because he didn't take off all. He went below the belly button, but not all. So that part kind of hangs. But again, at least it's not. It just looks like I have a big, like almost like I'm pregnant and carrying high. That's kind of how it looks. The actual, incision that's open is disgusting. My husband said it looks like Little Shop of Horrors. It looks like Little Shop of Horrors. And basically what happened was that first night was okay, but I just kept scratching and scratching and scratching at the tape. I started forming blisters. I was bleeding. And as I scratched, I broke the seal. And that thing was driving me crazy. It did not let me sleep. It was so loud, and it was beeping every 5 minutes. And I called the company and they said, you broke the seal. You have to go to the emergency room right now and reseal that because you can't just leave that wound, all covered like that. It's got to be able to drain. So I'm in the emergency room that second day out, and oh my goodness, 3 hours they spent sealing that and sealing that and sealing that. And we called the company up again, and that nothing is working. It's just beep, beep, beep every 5 minutes. No sleep. I was ready to go out of my mind. And the doctor couldn't get it. I felt so bad. And I tried calling. They gave me their cards, and my assistant doctor gave me her card, but I couldn't find it. I'm calling and calling, and nobody's answering. And then thank God she calls me, and I told her this is driving me nuts. And she says, okay, if it works, it's great. You heal faster. But if it does, some people just won't work for it. Rip it all off. You should see the sores I had. I don't want to take pictures because not only is it gross, but I can't wear underwear. So I'm not going to show my JJ to everybody. But the sores, all the sores I had from the tape. So we spent like $65 on supplies trying to get sensitive skin stuff. You have to pack it with gauze, you have to put a pad over that, and to absorb the fluid, and then you got to tape it down really good. And I was even reacting to that. I had blisters, I was bleeding, and so the doctor said that looks like it's infected, because I go to him every week. And I'm in pain, and when I call him, I'm telling him something's not right, and he's like, stop being so fixated on the drains. Nobody likes the drains. It's not the drains. But if you see a picture of the drains, it moves around. It's uncomfortable. So it moves around. It's uncomfortable. Basically, they were trying to keep me in the hospital again after they were going to discharge me because I needed a home care attendant. And they come every 3 days and they change out, because blood just fills up in there. It smelled like period, but it was horrible. They have to change out the canister where the blood goes into. And again, they're saying, well, we're not going to be able to do that till Monday morning. So, we can't send you home without a home health care nurse. And I'm like, they're not going to be able to come Monday anyway. And they're not getting it. I'm leaving. I'm leaving. And they were like, you feel ready to go home? Yeah, in my own comfortable bed, yes. I couldn't take 5 days of that bed. And for nothing, because they were really good about getting things done. The home health care attendant called me but said, look, we need to verify your insurance. We won't be able to verify it till Monday. And then, they give me a choice of days that they can come. And so I wasn't going to be sitting in the hospital just because we needed to wait on that, and for nothing, because none of it worked out. Since I had to take out the wound vac, I didn't need a home health care attendant. Because I had to change the gauze every 3 times a day, even though we mostly do 2 times a day, once in the morning, once at night. While my husband was home, he was changing it 3 times a day, but now they have to go to work. We change it in the morning, and then at night after I take a shower. So all of that would have been for nothing. So I didn't need the home health care attendant because she's not going to come 3 times a day. She's only going to come 3 times a week. So, and my house was upside down. I haven't been able to clean. I'm not supposed to do any forceful lifting or anything. And I'm not in any position to do that. My daughter was keeping up with the kitchen, or they would vacuum, but my bathroom. Oh my goodness, I'm just spraying the toilet seat down with Lysol. I'm just trying to do everything possible because that incision is right above my vajayjay. So when I sit on the toilet, it hits the toilet. Sometimes it is painful. So I see my doctor every week, and he keeps pushing off taking out the stitches, and the stitches itch, they poke, they pinch, and I'm ready to just pull everything out. My husband wasn't packing the wound, he was just laying gauze on top with saline and taping. He says, no, you got to shove it in there. Everything was fine until that happened. So 5 days out of surgery, I'm feeling great. Boom, the doctor puts gauze inside the wound, and that's when my problem started. He packed it so tight, I think it hit the um, the tubes. I had pain in my belly button. I have pain on my side. I can't. They put the tubes in my hips. So even if I go to my recliner, it's squeezing the tubes. I cannot just, sleep sitting up on my bed. It's, your pillows fall out. And so I cannot sleep on my right side. I can only sleep on my left side. And every day it was like 300, whatever these are, milligrams or milliliters. I don't know what these are, ounces or something. What is this? I don't even know. 300 of like liquid, and it's blood and body fluids, went down to like 100. I was so happy, or 80. And then out of nowhere, it went up to 200 again. I was going out of my mind. I want these tubes out so bad. But thank God, as of today, I noticed yesterday that they can take it out once it goes to 30 or less. And yesterday, I noticed my right side went to 40, and today, like, it's just got a couple of drops in there. So, which means that if it stays like that for 2 days, which I pray to God it does, then they can take it out. But my left one is the one that went up to like 200. Yesterday was 150. And that one's filling up halfway every couple of hours, which is horrible. But that one doesn't hurt me as much. But it itches on the stitches. It itches where they put the tubes in you. I got 2 holes in me. You gotta tape it, and I try to cover it up with a scarf because it was hot when I got home from the hospital. Hot, muggy, humid. I was dying. Thank God. When I went to see him, he said I could take a shower. So since we took the wound back out, I could take a shower. So no baths, but you can take a shower. I spent extra long, and I still spend. Usually, I take a quickie shower. I just put soap on me and scrub my face, and I'm not one of those people that spends an hour in the shower. Now I spend a long time in the shower because I feel so nasty from all the dripping and my belly. I knew this was going to happen. The fat on my thighs, it puts so much pressure on it that I have hanging skin on the front of my thighs. Like the rest of my thighs fine, but just in the front, it almost looks like 2 ball sacks. It's horrible. I was hoping that maybe they would take that off too, but it's so that part, it's just always just feels nasty, and so I have to sometimes wipe myself with a washcloth, but I take extra long showers now. I use double the soap now. So he keeps telling me he's gonna take out stitches, and then he doesn't, and I'm dying. And the stitches itch, so he took out every other stitch, but he was like in a hurry because he had to be somewhere, so he did it on one side, but the other side I noticed he didn't, and it was itching. And then sometimes when you scratch it, this gunk comes out of it where your stitches are, and I don't know if it's dirt accumulation. Nurse told me yesterday it's probably blood with body fluid. And so I was scratching yesterday, and I don't know what I did. I don't know if I busted a stitch, but I felt this blood just pouring down my legs. And then the pain, I had this horrible pain. It feels like the tube is trying to come out of me. It feels like it's trying to come out right through the skin. And I was in so much severe pain, a heart stomping, breath stopping pain. And my husband was exhausted, and he came back from work, and I knew he didn't want to go, so I was just trying to hold out. At first I was just taking 1. They said I could take 2 tramadol. It doesn't really do much. I have a bottle of Oxy, and I thought it was from last time when I did my kidneys. I thought it was Oxy for pain. It's oxybutynin, which is for antispasms for your bladder. but it made me sleepy. I don't want to take it again though. So basically, I take two tramadol and my naproxen, and it helped. But every time I moved, it was this burning, searing pain, and so I looked it up, and they said that sometimes it could break inside of you or cause an infection and blah blah blah. So my husband is like, "Let's go now. I don't want to be sleeping." And then you try to get me to go 2 o'clock in the morning. So we went. It started at 6. I think we got to the hospital at 8. I called my doctor first to do a sonogram. Nobody will touch me. When I went to the hospital, the emergency room the first time, he said, "I will not take this off of you. You are under the care of a surgeon. I will just try to seal it. 3 hours, nothing." I called my doctor because I'm in pain. My PCP, they will not touch me. They said, "You are under the care of a surgeon. We cannot touch you. Go to the emergency room." When I called my doctor and I told him I felt like I couldn't breathe from the pain that he packed it so much. He's like, "Stop being fixated on the tubes. Nobody likes the tubes. If you feel like you can't breathe, just go to the emergency room." So basically he said, "Tell your husband not to pack it so tight." It was just horrible, the pain. So it's been closing up on the inside, but it's still open. It still hasn't formed a scab. They said it takes between a month. It could take up to a whole year, which is horrible. So I can't wear underwear until all of this is healed. And so I went to the emergency room last night asking if they could please just give me a sonogram because this pain was horrific. They won't touch me. I said, "Look, my doctor, my PCP and my surgeon told me to come, And they're like, "Nope." No. You need to go when you see a plastic surgeon. I see him once a week. You talk to him about it. But the good news is that since the tube isn't producing any more fluids, it can come out. So, this, at least once I can come out, he's going to finish taking off the stitches, and I'll just have to deal with the other one that's producing a lot of fluid. And they will not stitch me up. I asked the doctor, "Look, the inside has been healed. Can you stitch it up now? Because I'm afraid infection will set in when I sit on a toilet." And they're like, "Nope, we can't do that." And then a couple of nurses I spoke to were in shock, but yesterday they said you can't seal it up. And I had to go see my endocrinologist, which she deals with diabetes. And I thought that because I was eating some carbs, not a lot, I already was on a low carb, but now I'm eating some, not just low. And I thought that my blood sugars were going to go up, but she said I did blood work last week, saw her this week, and she was like, "You are doing fantastic. Your diabetes is all the way down. You've got normal blood sugar levels right now. Your thyroids are doing great. Everything about you, at least from this aspect, is wonderful." But every doctor, and the truth is I could just do this with my PCP. Every doctor's telling me, "Oh, but we just want to do a follow-up." Next year I'm going to have to start paying, $40 per doctor. But they all want me to do the follow-ups. And I'm doing therapy and seeing a psychiatrist for my anxiety pills. So I'm not sure what I'm going to be doing with that. But, she says, "Oh, since you have an open wound, I really want to see you, regularly to make sure that you're doing okay with your diabetes and your healing." And my stomach doctor says, "Oh, I got to check your liver function, so you got to come once a year." And all of this stuff my PCP does already. So, and if I need refills, I can always go to my PCP. And of course, I have to see my heart cardiologist every couple of months. And so, like right now, I'm itching like crazy. Most of the sores are healed. The blister is dried up, but it's still scabby. So I've been using hydrocortisone cream. I've been using antibacterial ointments. So most of my sores are healed. I'm down to just the scabbing of the blister. but the silicone rubs against my skin and it itches. They explained to me, the nurse called me early. Well, not early. She called me about night. He called me at 9:30 this morning, and he was trying to explain to me that the pain is the healing process. It's, you know, that when they saw me, they see no infection. I'm irritated, but they're saying it's not an infection. Because I had to go back on antibiotics. They give you antibiotics so you don't get an infection, but my skin was from everything. It was just infected with blisters and sore, and it's still red and it still irritates me. But they're saying there's no more infection. I don't need to take antibiotics anymore. So um, all I can say is they were not kidding about the healing process, and I didn't never dreamed it was going to be this bad, because when I had my hysterectomy, I felt like crap for a month, but I healed and I didn't have no problems. But all of these tubes and leaving in the stitches and leaving an open gap, I've never had to experience that before. And I think hysterectomy is more of a major surgery than this. And this is very frustrating. And of course, it's going to take longer to heal if you leave an open wound. Um, so these tubes are in me. Once they take out the tubes, then you have to be careful that where the holes are, they'll form a scab. You have to be careful that doesn't become infected. Sometimes from the holes themselves, liquid pours out of that. Um, it's this is the worst part for me. Is this, like, I'm talking to you and I'm just itching from the stitches. I'm itching. They said this is silicone, but I feel like it irritates me. But yeah, so I mean, I have my good days and I have my bad days, and I try to stay away from the tramadol, but I have to take it, and I take two, and I'll take naproxen. Sometimes I'll have to take Tylenol for my arthritis, because he put it right in my hips. These holes, the tubes are in my hips, going into my abdomen to collect all the fluid. So I get tired a lot easier, but I can get up the stairs now with no problem. Before, it took me forever to get up the stairs, and now I can get up the stairs much more easily. I can walk much more easily. I have a lot less pain. But they tell you don't sleep on the tubes, but I cannot sleep sitting up. And since the tubes are on my hip, the sofa still kind of squeezes it. If I move wrong, these tubes snag on everything. It is stitched up at the hole so it doesn't come out. But the pain of your skin, it feels like your skin is trying to be ripped off. It snags on things. Sometimes I go to straighten out my dress, I accidentally pull it. It is horrible, 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 these tubes. But, my friend gave me advice. I was ready to pull them out myself. I looked up how to take it out. How you snip out the stitches and all that. My friend's like, please don't do it, because I took it out. I did that. I had my doctors take it out. They were like, no, 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 you're still producing fluid. She's like, I don't care. I can't take it anymore. And she wound up getting infections in her body that took forever to heal, to get rid of. So I'm trying to be patient. I think my doctor's so frustrated with me because I complain. I feel bad, because I should be grateful, and I am grateful that he was willing to do the surgery when nobody else was. But this healing process is just horrible. And I question it. I question, does he do this so I could keep coming back every week? Thank goodness I'm having everything paid for right now. Now I know why he said you need to do it before December. But, my endocrinologist, the diabetes doctor, and the nurses were telling me last night and this morning, he's doing what he feels he needs to do for what's in your best interest. You can't stitch it up. It won't heal. Just gotta let it take its course. And the itching and the pain is normal, because your skin is still healing. You have a lot of pain receptors in your skin. And this is all just a normal part of the healing process. Just, your doctor is thinking of you and blah, blah, blah. And I'm like, Every time I see him, I just complain, when are these coming out? When are these coming out? And I feel bad. I should be more grateful to him. And he says it. He said it when we first saw him. You're gonna see me. We're gonna be sick of each other. We're gonna have to see each other so much. So anyway, so that's how I'm doing. I pray to God that this doesn't start filling up again. But I should have one tube out. I should have all the stitches out, and I'll probably be feeling a lot better for Thanksgiving. I'll just have one tube in me. So, and that side doesn't hurt me. I sleep on that side. I sometimes have to wake up, give my side a chance to rest from being sore. So I'll stay up for an hour. Sometimes I don't know, do my nails, play my handheld games, whatever, play Candy Crush. Then I'll go back to bed and sleep. I wake up maybe twice and do that. I was able to actually start sleeping on my left, so I didn't have interrupted sleep. But yesterday with that pain, oh my goodness. So it's rough. It just seems like it's going to be a long process. And I was just like ready to just go. And I'm like, nope, nope, it's not going to happen. They want you to move. I mean, I'm out every day. I got to drive. I'll run errands or, do groceries. Well, I still ride the putt-putt because you can't really exert yourself too much. Drive my son, go to the doctor, So, I'm out and about, and even when I'm home, I try to do some light cleaning. I'm not just sitting down. My butt hurts. Like right now, my butt hurts. So, it's just a very slow process. Like I'll be doing a little bit better every day, and then boom, a pain will hit me, and I'm feeling like crap again for a day or two, and then I'll start feeling better, and then something else will happen, and I'm just glad that I don't have that hanging belly anymore, causing me pain with the infections, pain on my back and my arthritis in my hips. I'm able to move about more freely with less pain, and no more sores and bleeding and infections and pus, and I have a lap finally. I can bend finally. I couldn't even pick up my own little chihuahua. Now I still can't because of but it's easier now. So I thank God for that. So yeah, next week I'll be home for the whole week, so I might do except on Monday I'm taking my son to school, rush to the doctor, and then come pick him up, come home. But I'll probably be home Tuesday, Wednesday, and Friday. We'll probably just I can't cook. I cannot be doing no Thanksgiving dinner, so we'll probably go to Golden Corral or Boston Market or something. So hopefully maybe I'll be able to do a video next week, because I really wanted to continue the Zodiac Wet n Wild series. So okay, I love you all. Happy Thanksgiving. Mwah.